MDabstract has been helping healthcare organizations since 2010 in two important ways. The first with data migration, usually from one EMR to their new electronic medical record system, and also in the ongoing efforts to prep charts on a daily basis so that providers have the clinical information they need when they see their patients in their new EMR system. We date back into clinical practice. That is where our company evolved. The founders and owners are all providers, and we knew that providers were going to need help as the healthcare industry really went into a more advanced electronic medical record system. It's a good endeavor. It's an important change in healthcare. But we need to preserve providers' ability to get to the clinical information they need when they're treating their patients at the point of care. And so our mission, if you will, the reason we exist is to preserve that ability to access clinical information at the point of care. We do it in really two service lines, if you will. We work in the data migration space. So when a health system is moving from one electronic medical record system to their new system, we are the service that comes in and handles the high-touch clinical data. So in that environment where they're moving that clinical information, much of it will be moved automatically, electronically. It'll be mapped, and that's great. It's very efficient. But there are always gaps, and there are needs to kind of come in and touch certain clinical data areas that have to be readied for that physician when they see their patient. It must be in the templates, so to speak. And so we help get that information in the right place at the right time so that provider comes in, they're confident, they're able to treat their patient, get their hands on all the clinical information they need to be able to develop a treatment plan and have the best outcome possible. So we preserve that provider's ability to access that information while that very important data migration process is going on. We're thrilled to be able to help in that way. Our culture, really, we are all providers at one point. We know how important it is in healthcare to be able to get our hands on that clinical information at the point you're treating the patient. So we support the transformation, if you will, that's occurring in healthcare really over the past 15 to 20 years. But we also preserve that provider's ability to get to that clinical information. The second part or service, if you will, that we provide is a very exciting part of it's really evolved from our expertise. And so we are able to help in the medical records workspace, if you will, of clinics across the country on a day in and day out basis. It's an ongoing service where we, because of our expertise and our knowledge of being able to navigate in any EMR system out there, we're able to augment the medical records staff in clinics and be able to help them ready charts every day. We simply virtually log in. We're able to get that chart ready, make sure that the chart is curated, all of the procedure results, test results, lab results, whatever it might be. We're able to get it in the right place at the right time and really augment the medical records work that does have to occur, even though everything has been digitized. We know there is a certain amount of touching that goes on every day in clinical practice, and so we're able to augment that. We're very excited about the service. We are helping a number of practices across the country on a daily basis, and we believe that this will be a very important aspect of the digital transformation that's occurred in healthcare over the next couple of decades. So very excited to be in that space, and certainly excited as a company. 14 years, and we continue to find ways to be of help, fill gaps, make sure that providers have everything they need as they treat their patients.